Okay, and now we start with system 2. Let's remember the Chinese names of meridians. We will start from Taiying or Taiyang, and corresponding is Taiying. Who are they? What is Taiyang?
Bladder.
Taiyang is Hentayang is small intestine, and Futayang
Bladder.
is urinary bladder. What about Taiying?
Lung.
Taiying is always lung, and Futayang is spleen, right? So let's go forward. What else we know?
Shaoyang.
Shaoyang and Shaoyin. Who are they? Shaoyang is Senjiao, or we call it triple heater or triple burner or triple energizer. Just let you know that whenever you find Senjiao is equal to triple heater is equal to triple energizer, or it's equal to triple burner. It's all the same. So Senjiao,
Gallbladder.
gallbladder. Well done. And what is Shaoyin?
Heart.
Heart and kidney. That's right. And the last one is
Juan.
Yang Ming and Jur Yin. Zhu Yin. What is Yang Ming? Is large intestine and stomach. And what is Zhu Yin? Is pericardium and liver. Food Zhu Yin. We learned system 1. System 1 here, you can see that small intestine and bladder are related by system 1. Lung will treat spleen, and spleen will treat lungs, because Taiying will treat Taiying. Xinjiao will treat gallbladder and vice versa. Heart and kidneys are related because Shaoying treats Shaoying. Large intestine will treat stomach, and stomach will treat large intestine because Yang Ming will treat itself. And the same about Zuying. So, the system 2 says that the branches of the same meridian will treat each other. So, in this case, small intestine will balance spleen, and spleen will balance small intestine. Hentayang will balance Futaying, and Futaying will balance Hentayang. So all the disorders on the small intestine area will be treated by needling spleen. Pain in scapula on a small intestine meridian will be treated by needling the corresponding area on the spleen meridian. For example, pain in the scapula over here. According to step number 1, which meridian is sick? Small intestine. If we go to step 2, which meridian will balance small intestine according to system 1?
Bladder.
Which meridian will balance small intestine according to system 2? And now we must choose the points according to mirror or image. Which will we use, mirror or image? Is it correspondence between limb and limb? No. This is the correspondence between trunk and the limb. So is this mirror or image? Image. Let's see what we're going to use, direct image or reverse image. If we project the trunk to the leg, so the scapula will be somewhere here around stomach 31. We can needle the area on the side, but look, it's not very convenient. So let's reverse the leg and see the correspondence between scapula and the leg. So the foot will be the head, the ankle will be the neck. Where is the scapula? Somewhere in the area bladder 59 and lower. Agree? So if we choose the bladder meridian to needle, we will choose the points around 59 and lower, or in this case is upper, towards 58. In the case we choose spleen meridian to needle, these points will be around spleen 6 and lower. This area will correspond to the scapula. Immediate results. System 2 treats either side. It means that we can needle right or left leg, doesn't matter what. But which leg will be better? How we choose the best side?
More painful.
More painful. So we palpate right and left and see which leg responds better. So we palpate for ashy points and see which ashy points are more painful, are more responsive. Is that clear? Beautiful. And now the correspondence that I use all the time in my clinic is that the lung or lung meridian will treat bladder meridian and bladder will treat lung. Foot taiyang will treat hand taiying and hand taiying will treat foot taiyang. And let's see how many points are on bladder meridian. 67. And how many points are on the lung meridian? 11. So look, 11 points on the lung meridian will treat the whole 67 points on the bladder meridian. The whole body will be treated. And this is really a gift because any pains around the waist area, due 4, bladder 23, bladder 24, any pains along the bladder meridian and the back will be treated by needling lung meridian with immediate results. It can be 100% pain relief. It can be 50% pain relief in some cases. But the result is immediate. So, for the pain in the sacrum, on the bladder meridian, how will we treat it? Step number 1, we found a sick meridian, bladder. Step number 2, according to system 2, for example, we've chosen the system 2. System 1 will work as well. According to system 2, we choose the lung meridian. And now, step number 3, we have to choose the points. And we have to decide what we use, mirror or image. Image, because we project the trunk to the arm. Which side? any side, either side. And now see which points correspond to the painful area.